Okay, so thanks everyone for coming back for our third day. I hope everyone had fun last week. And as always, if you have any questions during the presentation, please feel free to put it in the chat or speak up. We love it whenever y'all ask questions. Y'all know that. So I think all of you should already have this done by now if you don't have your One Health curriculum. I know I asked earlier, but if any of you are still having any problems with that, direct message Margaret. She's our tech support for today. She's really, really great, so don't be afraid to reach out, all right?
Yes, please do. I can usually find, I haven't been fooled yet. We can find a way to help you out, okay?
My chat disappeared. There it is. Okay. So we're going to give you a little bit of a recap from last week, the second presentation we had. So in last week's presentation, we explored some cell types and their associated structures, and we examined the different cell types and how they play into the microbes found in the bovine stomach. So does anybody have a cool fact or something that they remember from the last presentation we had? You can put a chat, you can unmute yourself. If you slept a lot this weekend, that's okay too.
I remember the disease that you were talking about, bovine trichoma, something like that, with a T.
Trick, what we talked about yesterday.
Yeah.
Yeah, good job, Erin. Bovine trichomonas. That is a mouthful to say.
It is.
Nice one.
Okay. And then we also explored the importance of prokaryotic and eukaryotic organisms. Does anyone remember the difference in those? Cells are alive. Anybody else?
Prokaryotic doesn't have a nucleus and eukaryotic has a nucleus.
Awesome. And then we also talked about the rumen acidosis and the impact that it has on the cow. So for today, y'all are going to be working through the following sections on y'all's One Health modules. And so again, we're going to go, if anyone has any problems with the whole reset, everything, we are more than happy to help. So today we're going to be doing the plant versus animal cells and then the levels of organization, okay? So both of these are pretty short. Depending on how long it takes y'all, we're going to give you about 20 or so minutes to do those. So following these, you're going to observe the disruption in a specified cell type and how that results in malformation or damage to those systems that they help. Okay, so y'all go ahead and go to the One Health modules. And if you need help, please let us know, okay? Okay, so everyone got those done. So how'd y'all like it? Did you learn anything? Was it hard? Was it easy? I see head nods. What are the head nods to? It was a good review of bio. Yeah.
We felt the same way when we opened it and we clicked through it. We were like, man, this takes us back. It's fun.
Okay. So we're gonna go ahead now that you've done your test for the day and get started on the information. So we're gonna start with levels of organization. So what can go wrong with that? So as many of you just learned, the creation of an organism is heavily reliant on a series of building blocks beginning at the cellular level. So that's the very, very first level before anything else can become an object. So without the proper formation of each cell, tissue, organ, and organ system, we can't have a properly functioning organism, which is super important to remember, guys. And as always, I have problems on my computer. There we go. So to illustrate this point, we're going to explain how disruption at a cellular level can impact an overall organism. So does anyone have any guesses of how disruption at a cellular level could impact an overall organism? Any guesses at all? Y'all know me, I'll call on somebody. You can't properly form the next levels. Good, Paisley. Mutations, I just saw that, Haley. Good idea. Awesome. So cancer, what exactly is it? Let's see, Jose said diseases. Good. So cancer is an uncontrolled replication of abnormal cells in the part of a body. An abnormal cell replication is not extremely common because the body works really, really hard to get rid of any damaged cells, but it doesn't always do that. I'm sure a handful of us know somebody, whether that's in our family or a close friend or a relative, something who has cancer. And so this is what happens during that. I'll share with you that my dad's currently fighting prostate cancer. So whenever I was going over this the first time, it was super intriguing to me because you don't really get a lot of information this in depth. So in some of y'all's like high school classes. So if you're into science, which I'm sure all of you are because you're here, this is super, super interesting and stuff that you probably won't hear until maybe you get to college. So for cancerous cells to form and replicate, those cells have to be exposed to multiple forms of injury. Does anyone have an idea? I just gave y'all a hint of what those forms of injury could be. So I'll give you another hint. Why do we have to wear sunscreen? Radiation. Good. So UV radiation from the sun is an example of that. And then there's also promoters that allow damaged cells to replicate, which aren't a good thing. And these are things like stress, inflammation, and hormones. Those can cause promoters to excel and replicate those cells that we don't want replicating. Once cancer cells are present and replicating, it can be very hard for the body's defense system to get them to stop. And so cancer cells do everything they can to replicate quickly and undetected. That is what they like to do. And we try and do everything in our power, and our body does too, to make that not happen. So does anyone have any questions about this slide?
Hey, what are we looking at in the image on the right?
Does anyone have any guesses?
Is that a cancer cell?
What an excellent guess. Yes.
Well,
So there's a mixture of both normal and abnormal cells here. The one that looks like it has, I don't know, two very bright, let me see. I can draw on Miss Kellen's screen. Everybody knows how to do that now.
by annotating.
Yeah, this one is what we call a mitotic figure. And being in high school, you've heard of mitosis. Mitosis is a form of is one of the things we look at when we're trying to decide if a cell is cancerous. And this one is a really ugly cell, meaning something is not normal with it, and so it's most likely malignant or cancerous.
However, all the cells that you see around it, which I believe you can see my mouth, so all of these that look super similar, those are healthy cells. So you can see the difference in all three of those. So canine osteosarcoma, what is it? Does anyone have a guess? Bone cancer. Good job, Dalton. Paisley. Yeah, so osteosarcoma is an aggressive form of bone cancer. Now we're right on the money. So when it accounts for only a small portion of cancer in dogs, or while it accounts for only a small portion of cancers in dogs, it's the most common form of bone cancer that we see as veterinarians. So it's super important for us to know basically all the things that y'all are going to get to go over and a little bit more so that we can identify these whenever we have dogs come into a clinic. So any breed can get an osteosarcoma, but is more common in large or giant breed dogs. So for large dogs, that could be like a golden retriever or a Labrador. What about a giant breed dog? What's an example of that? Great Dane, good. So we have Scottish Deerhounds, Rottweilers, Boxers, Doberman Pinschers, Danes, good job guys, Golden Retrievers, and many, many more. So like we said earlier, any breed can get it, but it is most common in larger giant breed dogs, which these are probably some of the most common that I have listed. Does anyone here have anything listed on that list? Yes, yes, got 2 yeses. 3
A Great
yeses.
Dane.
You have a Great Dane, that's awesome. I don't know many people who have Great Danes. Yeah, so good. So you're already learning something about your own pets. So male dogs ages 7 to 9 are most affected. Another fun fact on that. So how does osteosarcoma come about? So there's special cells, they're called osteoblasts, that are a part of our normal bone. So there's different types of cells that make up a bone. And this osteoblast is considered part of the normal bone, and its job is to create new bone. So as you grow, or let's say if you were to break a bone and you needed to create some new, that's what the osteoblast job is. So it's very important in growth, development, and bone health. They help replace old or damaged bone. And it is normal for osteoblasts to be present throughout an animal's or a person's life. So this is the same thing as for y'all. It 100% applies to you as far as the osteoblasts are concerned. So new bone is created by osteoblast. It's called an osteoid, which is, I think it's easy to remember since they both have kind of the same word. So the osteoid is softer than a normal bone. Oh, Let me go back. Again, computer wants to do some weird things. Okay. So osteosarcoma, which is an osteoblast unhinged. So if an osteoblast forms abnormally, they can begin creating abnormal osteoids. So who remembers what an osteoid is? Anybody? Soft bone. Good job, guys. So remember, cells can become abnormal for many different reasons. And so again, osteoid is softer than a regular bone. So this abnormal osteoid is spindle in shape, and it spreads throughout the affected area. And this can cause the affected bone to weaken, making it painful and susceptible to fracture. So in this picture, you can see some of them. This is a bone. And you can see the formation of these cells, which are the osteoids. Can everyone see that? Yeah, okay. So yeah, when these cells are abnormally developed, this is whenever the osteosarcoma forms. So where does the osteosarcoma like to pop up? Who has a guess? Joints. What else we got? Your fractures. Anybody else? Okay. So dogs, affected bones are generally the long bones. So who thinks they know what an example of a long bone is? There's long bones and short bones. So we got a femur. Humerus. Good job on y'all's anatomy. Large bones. Femur. Okay, so good job, guys. So example of long bones are the humerus, the radius ulna, the femur, the tibia, which all of those were said in the chat, so that's really awesome. So the saying goes, away from the elbow and towards the knee. So these tumors like to pop up far away from the dog's elbow in the forelimb and very close to the knee in the hind limb. Does that make sense? If I can see everyone's faces. Yeah, I see some nods. Okay. So this is because these areas possess growth plates. Lots of bone growth means a greater chance for mistakes occurring. So if any of you might remember whenever you were kids and maybe your leg hurt or your arm hurt and it wasn't because you did anything to it, but it just kind of ached. Yeah. So those were your growth plates. So you were growing up. We got some yeses in the chat. So you were growing up and your bones were growing. That's simply it. And so this can be kind of painful for us, and same thing for dogs and cats, and any other species you may choose. But that is also why we have to be really careful during those times, because there's a greater chance for mistakes. And however, flat bones can also be affected. It's just not very common. So does anyone have an example of a flat bone or think they know? Your collarbone, shoulder blade, hip. There's some guesses in the chat. Feet, ribs. Those are good guesses, guys. So flat bones include ribs, good job. Our skull, good job, Jose and Nancy. Our vertebrae, so that means like our spine. So diagnosing a canine osteosarcoma. So this is super important in veterinary medicine. As you can see, this is an X-ray here. So radiographs of the affected limb are generally the first step in diagnosing suspected canine osteosarcomas. And a radiograph is the proper term for taking an X-ray. So how many of you have ever had an X-ray? Yes, I have. I had one done last week. Yeah, so that's the same thing as having a radiograph done. So if the radiograph shows changes in characteristics of osteosarcomas, a biopsy will need to be confirmed. So who knows what a biopsy is? When they touch where the bone is, okay. Any other guesses, guys? Okay. So a biopsy is a tissue sample, meaning that they will go in, you examine tissue, good job, Brianna. So that's when you go in and you take a sample of the affected area. That could be as simple as, so say we have something on our skin and they go and cut something off of your skin. But let's say it's in the bone, that's where they would go in and get a sample of that tissue. So in this case, the sample we need to be taken is from within the affected bone. So they actually have to go inside of the bone and take a sample. The reason a biopsy must be performed is because there are other diseases that create similar changes on radiographs. So we have to be sure that what we're diagnosing is what they actually have. Do we have any questions about that? No? Okay. On we go. So complications associated with an osteosarcoma. Does anyone have a guess on what a complication might be in this case? I like y'all's thoughtful faces that y'all make. I can see you thinking hard. Ah, I didn't see this earlier. So somebody said, so like an autopsy, but with a living person. A little bit different. They're not quite the same thing. But if that helps you picture what it is, going into one single part while the person is still alive, they would totally be sedated and just like you were going in for surgery, but sort of. So we have cancer, diseases, spreading, problems caused by the osteosarcoma. So by the time canine osteosarcoma is diagnosed, it has already metastasized in 90% of cases. So what is metastasize? Does anyone know that term? Spread cancer. Grown. I love all the guesses, guys. Worsened. So in short, metastasize is the spread of a tumor to a new location. So if you've ever heard maybe a real life example with a human saying somebody has a certain type of cancer and it's spread to a different part of the body. That is what metastasis means. So there are particular places in the body that osteosarcomas like to metastasize to, and the most common of these is the lungs. So you can see this picture here we have. This is a picture of that case exactly. So it metastasized to the lungs. And you can see the damage that it's done to these lungs. You can see it here, you can see it here. It got really dark over here. So metastasis of an osteosarcoma, so in the lung specifically. So when a definitive diagnosis of canine osteosarcoma has been reached in the patient, the next step always needs to be to perform a thoracic radiograph. And a radiograph is another word for what? X-ray. Good job, guys. So in this picture over here on the right, this is an X-ray of the thoracic cavity, which is basically like your chest area. So let me move my chat, maybe, if it'll let me. Well, okay, so in this picture up here on the right, so here's the spine, and here's the esophagus, so like where your food travels, and here are the lungs in this general area. So in simplest terms, that means we need to make a chest x-ray. So we anticipate that in time, our canine patient will exhibit signs of tumor formation on the lungs following a diagnosis of the canine osteosarcoma. So if you remember the picture on the last slide, I pointed out to you that there were circles of something. Those could be little tumors forming on the lungs. I'm not 100% sure because I did not, pick that picture for this. So these tumors may not be present also in the initial radiographs following diagnosis. But when it's valuable for us to have a baseline tracking the progression of the disease. So what that means is maybe we take an x-ray on day 1 and we don't see anything. And then we take an x-ray on day 30 and maybe we can see something at that point. And then maybe we're going to take an x-ray on day 60 and we can see the progression between those 0 to 30 days and 30 to 60 days. So we can see how it's developing. So this helps us understand how fast it's spreading. So treatment options for metastatic canine osteosarcoma. So treatment options follow 2 different approaches. So one can be supportive care for pain. So that can mean like pain medicines or maybe injections that help them feel better. Implemented at the request of the owner or in the event that the tumor formation of the lungs is already extensive, meaning that it's really, really bad, and that might be the best choice of care for that animal. The second option is trying to cure the patient. So this may include surgery, radiation therapy, or chemotherapy. Unfortunately, this option may not be available to everyone as it can become very expensive. So at times, supportive care can be the best option for those. But having chemotherapy and radiation therapy is 100% something that we do, and some people do often as well. So, prognosis of a metastatic canine osteosarcoma. So unfortunately, metastatic canine osteosarcomas are generally a fatal diagnosis for our canine companions. So does anyone know what that means? It's more fatal for them, deadly. Yeah, so death is caused by damage to the lungs from the metastatic tumors that form there. So with extensive medical intervention, dogs with metastatic canine osteosarcoma have been found to live 2 years following their diagnosis. So we're gonna bring this round in full circle. So before we get to this, does anybody have any questions so far about anything we've covered?
Yeah, that was quite a few very doctory terms, which we love to talk about, but if you have any questions, we're happy to.
That's why I always like to stop and make sure that we understand. No questions? Well, good. That just means I'm really good at presenting this.
I would really like to hear Miss Callan say canine metastatic osteosarcoma 5 times fast, though, because
I'm already getting tongue-tied on it. But if every single person I gotta pull this up before I can even say what I'm gonna say, guys. If every single person starts their video, I will. That way I can see everybody's faces.
how about this? I'll one up you. You can do it, and then I can do it, and then they can, watch and see who does it better.
Hi, guys. Hello. It takes a little coaxing to get the cameras on, huh?
They want us to look goofy. That's fine. I can take it.
Oh, it's not everyone yet.
Here they come.
And I'll show you my dog because she's currently under my elbow. Oh, did that get some people? You want to see the dog?
I think that looks like it's everybody. Look at them. Okay.
Wait, but we have Dalton. I don't see Dalton's face.
Oh, Dalton, where are you at, man?
Or Christopher's face. Or Miranda's face. Ah, there's Dalton's face. What about Miranda's face? Tim's face? Okay, so that is everybody except for 5 people. So I guess that constitutes saying it, huh?
I think we should give it to him. Yeah.
Yeah.
All right.
So.
This awful idea was mine, so I guess I'll go first.
Mm-hmm.
Okay. Okay. Canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma.
She did it.
I can just hear everybody. Yeah, look at my applause. Thanks, guys. I felt really good about that. It's going to be a good day. All right, let's watch Callan do it.
So here's my puppy, guys. She's not really a puppy. This is Willa. She's been nudging my elbow. Say hi. Yeah. She's been listening all about Canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma, canine metastatic osteosarcoma.
Ah, see, I knew you could do it.
Little
Good
tongue twister, but it's
I hope that that was as entertaining for you guys as it was for me.
okay. Okay.
You got some applause too. Way to go. Way to cheer her on.
Thank you.
Yeah.
I'm bowing.
All right.
Let me get
Any questions now? We had to give you a second to think about it. Willa is adorable. You're right, Heaven.
oh, my chat isn't pulled up. I have to see this. You're talking about my dog. Oh boy. There we go. Yes, she is adorable. And I also put words up, but didn't mean to. Yep. Okay, so bringing this into full circle. So we just spent a good amount of time observing how the disruption at a cellular level can lead to tissue, organ, and eventually organ system damage. So in the case of a metastatic canine osteosarcoma, this occurs in two parts of the body. Does anyone have any guesses?
Lungs?
Someone said lungs. We got stomach on the chat. I love seeing everyone's faces, guys. I keep having to move everyone's around so I can see the screen. So our long bones, which the cell for those is called the osteoblasts. The tissue of those, which is the connective tissue. The organ, which is the bone. And the organ system, which is the skeletal system. So if you see up here in this first paragraph, we talked about can lead tissue at the cellular level, can lead to tissue, organ, and eventually organ system damage. So we have the tissue, which is the osteoblast. The cellular level is the osteoblast, the tissue, connective tissue to the organ system, which is bone to skeletal system. So this is how that works. And the second one, a lot of you guessed it, is the lungs. So for the cell, metastatic osteoblast disrupts a normal lung cell function. So it has a pseudostratified columnar epithelium. And I know that's a really big word. That is just the type of cell that it is and the shape of it. And so the tissue is called epithelial tissue. And the organ is the lung, and the organ system is the respiratory system. Does that make sense to everyone? Yeah, see head nods? Do I have any no head nods? I can see almost all of you at one time, so I'll know. Okay. So, what did you learn? What have you learned today? Or any new interesting facts or things that just stick out in your mind? How to color. Yes, you're right. However,
Yeah, maybe not the main goal.
not the main goal of today, but I'm glad you figured out how to annotate. Oh, hi, buddy. So big dogs are more likely to get certain cancers. Plant cells have organelles that animal cells do not. Osteosarcomas. Abnormal cells are healthy cells, but emo. On the picture, they're darker. It occurs in long bones. Good job. Sorry, my cat is trying to jump up in my lap. I do have a cat. Before we end today, I will show you. Yes, yes, yes. How osteosarcoma affects dogs. Good job, guys. So we are actually done for the day. However, we're not quite done. So my words got all jumbled in these. So we will see you tomorrow. So right here, our last presentation will be tomorrow, Thursday, June 16th at 1 p.m. It's the same Zoom link, same place, same time. But remember, those of you who hang out with us through all of the presentations, based on our Zoom, will get a prize for answering the most Kahoot questions correctly. And so we know we had a group from UT Rio Grande Valley. Yes. So those are our newbies, and we were super excited and happy for them to be here. We do have the recordings out for anyone who may have missed something or wants to go back and watch something. So please know that those are available to everybody. And so we do have a quick presentation that we can go over with you guys. It's about different careers in veterinary medicine. There's a lot more than you may think. So if any of you want us to go over that, we are more than happy to do that. We love talking about veterinary medicine and what we plan to do in the future. And I know that there are a handful of you that are also super interested in going into veterinary medicine. So how does everyone feel about that? Do we want to do that, or are y'all just worn out? And Dr. Johnson said cancer displays a high density of dividing cells and is used in biopsy analysis. Yes, yes, do it. Okay. Yes. So, where'd he go? I will go grab my cat and show you guys while Margaret pulls up that presentation. I will be right back.
But we are now getting the pet report of today. It's almost like the weather reports. We found out that Dalton has 3 cats. And so do other people. I do not have a cat. I have 2 beautiful Labradors. But let's meet Pogo, and then we'll get started with this one.
So this is my kitty cat. His name is Pogo. I named him that because he has 3 legs. He's missing this front right one. He's a super, super sweet boy. He actually just got back from the vet yesterday because he decided to eat something he wasn't supposed to. So he has a cute little bandana on currently. So yeah, this is my Pogie boy. So hi guys.
They are big fans. Thanks for sharing him with us.
Yeah.
All right. So I know yesterday the UT Rio Grande Valley kids had some questions about vet medicine, and I know that our kids from last week also had some questions. So we thought, another good way to approach maybe answering some of the questions on your mind would be to go ahead and talk about how careers in veterinary medicine can happen. So this one was created by Kristen as well as us. Kristen wasn't able to be here this afternoon, but we thank her for helping us make it. See if I can, there we go. So main goals of a veterinarian are actually threefold. So we do prevention of disease. Oops, no spoilers. An ounce of prevention is worth a pound of cure. So we're really big on preventing the disease before it can occur. We do that by providing puppies with their vaccines, adult dogs with their vaccines, cattle with their vaccines. Personal protective equipment and biosecurity. Those are really important because a large part of our job is to worry about what we call a zoonotic disease, or disease that can affect both humans and animals. So there are some diseases that you might get from your livestock if you aren't careful and you don't wear the correct personal protective equipment. Now, for diagnosing disease, what thoughts do you guys have about how we do that? X-rays, or as we learned today, a radiograph. We examine them, you're right. A huge part of what we do is we just put our hands on them and do a physical exam. Blood tests, very good. Checking for symptoms, that's exactly right. So, whoops. Diagnostics are important not only for if the animal is actually sick, but also they can play a huge role in our first part of our description of this career, which is prevention. So we can look at the clinical signs, which is the doctor word for symptoms, like Dalton mentioned. We can run diagnostic tests to either prove that an animal does have the disease we suspect, or to test to make sure that it does not have a disease before we give a certain type of treatment. An example would be every year, if you bring your dog and cat to the vet, your veterinarian will ask to run a heartworm test. And the test, we hope, will prove that your dog or cat does not have heartworms. That way we know it is safe to continue giving them their heartworm preventative medication. And then we also run blood work, like was mentioned, as a form of diagnostic tests or x-rays. And then another important thing is new and emerging diseases. Sometimes veterinarians encounter things that they haven't seen before or are very uncharacteristic for the area that they practice medicine. So if you were in Las Vegas, like we talked about yesterday with the UT kids, it would be very unusual to find heartworm disease because they don't have mosquitoes in Las Vegas. So, and that would be considered a strange disease in the wrong spot. And sometimes we can find other examples of that. So there was a recent article about a veterinarian who encountered a tick on one of his patients that was not common to the area. And it turned out that the Centers for Disease Control did not know that that type of dangerous tick was in the United States, and they needed to know about it. So the veterinarian was able to inform people that are in charge of human health because they paid attention and diagnosed the tick. And then we treat disease. So that can be surgery, it can be medication. So something to make their stomach ache feel better, or to make their arthritis hurt less, or it can come in the form of supportive care. So when Callan's kitty was not feeling well, they gave Pogo a lot of IV fluids because he wasn't hydrated well enough. So that would be an example of supportive care. Does anybody have any questions about that? No? I'm just a word wizard, I suppose. Okay. Please feel free to speak up if you have any questions at all. So, veterinarians by the numbers. There aren't really very many veterinarians in the United States, and that's because there's not very many schools. There's 30 accredited schools in the United States where you can get the Doctor of Veterinary Medicine degree, like Callan and I are studying to get. And there's 20 elsewhere outside of the United States in the world. So that's only 50 total in the world where you can learn to be a veterinarian. By comparison, there are 120 medical schools. So that just kind of shows you how few and far between the opportunities are to get the education needed to be a veterinarian. 113,394 veterinarians in the US in 2018. I recently read a number that in 2019, there was over 300,000 Angus beef cattle in Texas. So if you think about even the cattle that we raised in one breed in the state of Texas outnumber the total number of veterinarians we have in the entire United States. The majority of those veterinarians practice in private practice, meaning they don't work for an academic institution like a vet school, or which would be public. They don't work for a drug company, which would be corporate. They don't work for USDA, which veterinarians do as a public servant. So majority of people who get their doctorate of veterinary medicine or DVM end up going into private practice. The average salary upon graduation is 93,000-ish. And we've been seeing an increase in employment because there's actually a shortage of veterinarians. As you can see, there's not very many of us, and there are lots of animals that need care. Why are there more human doctors than veterinarians? Well, that's a good question, Dr. Johnson. That's because it's easier to get access to your medical school education. There's more schools available and more spots available to teach people to become doctors. Here at A&M, we receive 900 applications to our program every year, and we only get to grant that to 160 people. As opposed to, I know that there are 12 medical schools in the state of Texas. And until this year, we're the only veterinary school until Texas Tech opened theirs this fall. Why is that? Why it's expensive to take your pet to the vet? Heaven, I'm not quite sure what you're asking. Are you saying it's because are you asking if that's because there's just not enough vets? If so, no, that's not quite why. There's no insurance in the veterinary care system like there is in the human care system. And so there isn't any kind of offset to cost. But veterinarians do try to keep their costs as low as possible while still providing quality care. So we wanted to bring this into the whole purpose of our camp, which is that veterinarians serve a huge role in One Health and public health. Now, we've already talked about in the first day of our camp what One Health is. It's the relationship between healthy people, healthy environments, and healthy animals. Now, I already spoke about how we deal with vaccinations in our animals, but another good one would be hygiene. So there are veterinarians, for example, in our military, whose whole job is to go out across the world and teach people how to keep their animals in cleaner environments so that their animals will be healthier. And then that makes them a better source of food for the humans. Does anybody have any questions about that? Whoops. Okay. So this is my favorite thing to talk about. There are many, many, many roles you can play as a veterinarian. The most common one we think about is the traditional role where you go into private practice and that's the vet you take your dog and your cat to. Well, there is additional training veterinarians can do to become a specialist. So they have veterinarians that their whole job is to look at x-rays or radiographs of horses. And the reason they do that is sometimes a broken leg in a horse could mean the difference between life and death. So the owner of the horse needs to know for sure that they're making the right decision about if they should do surgery or not. So they want to send the radiograph or x-ray to somebody who that's all they do is study x-rays of horses. And so that would be an equine radiologist in veterinary specialty. It does require board certification to be a specialist. So after you've done your 4 years of vet school, you're usually required to do a 1-year internship. And then depending on the specialty, because as you can see, there's 40 of them available, it could take either 1 additional internship, 2 to 3 years of residency, maybe more internship time, and then you have to sit an exam to prove that you know your stuff and that you are qualified to be called a specialist. So me personally, I would like to be a surgical specialist for small animals. So when I graduate from vet school, I'm going to have to do a rotating internship, and then I will have to do a residency for 2 to 3 years. The benefits of being a specialist are that you do get to work in pretty unique environments. So I hope to work as a professor in a vet school. You get the benefit of advanced training. And then depending on what you're doing as a specialist, you will end up usually making a little bit more in your salary. So this example here that's changing is showing us a veterinary pathologist. So Callan talked about finding cancer in our patients, and we have veterinarians who their whole job is to look at tissue samples like this one and tell us what happened to that animal or what is making them sick. And then at the top here, we have a specialist doing an ultrasound on a cat. And then right here, we have a surgeon, which is what I want to be. And then we have an ophthalmologist. So the person who looks at your eyes and tells you what's wrong. We have people that do that just for dogs and cats or just for horses. So this one is, I feel like, just for Callan. Callan wants to be a large mixed animal vet. And so if you see here, look, only 4,000 veterinarians do that job. And so she's actually going to be meeting a really important need, as opposed to companion animal vets or your small animal vet that does your dogs and your cats. 48,000 or almost 49,000 do that role. And that's out of that $113,000 we talked about. I want to work in a college or university, so that's only about 6,000 or 7,000 of the 113,000. But take a look here. You have food animal, you have equine, you have other, which would be, say, a zoo or aquarium veterinarian. You have federal government, which would be the FDA or the CDC or the USDA. Uniform services, you can be a military veterinarian. And then not listed above. There are some categories that veterinarians just don't fit in because there's so many things we can do with our degree. So I'm going to wrap up with just a quick description of traditional veterinarians. So you have the companion animal veterinarian, who you're probably most familiar with, unless you live on a farm, which would be a large animal veterinarian. These will be your dogs, your cats. If you have a gerbil or a rabbit or a snake, then they'll be the ones that you'll want to go see. And they do these same core things we talked about. They do preventative medicine, they do treatment, and then wellness kind of fits under the category of preventative medicine. How can we make your puppy or kitten set up their life for success by giving them the right round of vaccines or parasite prevention? And then as you progress through the life stages of your pet, how can we annually make sure your dog or cat are as healthy as possible? And then as your pet ages into senior age, how can we see them a couple times a year to keep them as healthy as possible as they age? And we have the food animal or equine vet. Typically, a food animal vet has a lot to do with herd health. So here's a food animal veterinarian at the top who is at what looks like probably a dairy or maybe a dry lot, depending on if they let their dairy cows out during the day or not. And sometimes their whole job is just to be there as an advocate for the cows and as somebody that the farmer can say, am I feeding my cows correctly? How could I do this better? Are we milking with enough hygiene? How can we make sure our cows are as healthy as possible? And that goes into the concept of herd health. They also are usually the large role of breeding soundness exams. So right here, this is a semen sample. And so the veterinarian will look under the microscope to see, do I think this bull will do a good job getting calves pregnant, or should we try another bull? For equine, a lot of what equine veterinarians deal with are dental care, which is what this horse here is undergoing. We sedate the horse and then we prop their mouth open and we can actually file their teeth so that they can chew their food correctly, which is a normal thing to do in all horses. Then there's hoof care, because horses only have one toe on each leg, so we need to take extra good care of those. And then we have GI care or gastrointestinal care. So the modern veterinarian is somebody that anybody can be. It just really depends on where you would like to take your career if you decide to join us. Does anybody have any questions? I know we're at the 3 o'clock mark, so I'd like to go ahead and be respectful of your time. It looks like Michelle has a question. Is residency in addition to the 4 years to get your DBM degree? Yes, ma'am, it is. But the difference is that while you are being trained, you're not actually in school. You're just not being paid a very high salary while you gain the benefit of learning from people who are teaching you their skills. It's kind of like apprenticeship in a way. So to be a specialist, it will require additional time on top of my 4 years of vet school. Thank you for that question. Anybody else?
I have a question. So, like, say you want to work at like a zoo, right? What
Mhm.
kind of like major would you need to go into?
That's a really good question. I would say that zoo veterinarians are required to have, I'm gonna stop sharing my screen so you can see my face better. Zoo veterinarians are required to have the same DVM degree as Callan or I would. So your major can be whatever you'd like it to be that you feel would give you the prerequisites you need to achieve admission to vet school. Now, I know people will still choose their interests in their degree, which would be helpful for zoo med, like zoology or biology, because then you would kind of get a broad arcing goal in your degree. But you could also easily be a chemistry major, which isn't very zoo based, and still be successful as a zoo veterinarian. Because once you go to vet school, you'll still be required to learn all of the domestic species like we are. And then you start gaining professional experience as a vet student at zoos. You can also volunteer in zoos while you're in college and while you're in vet school, so that you can prove and show on your residency application that, look, see, I've shown you this is what I'm really passionate about, and this is what I would like to do as a doctor. Does that help? Good. Okay. Any other questions? We got some head shakes, no. Well, we have one more day together tomorrow. So if you think of any overnight about careers in vet med, or how would I become a fish doctor or anything like that, you just let us know, and we'll do our best to get you the right pathway answer. Okay.
Also, on our website, we have some videos of interviewing veterinary students and how to go about getting there too. I don't know if they go to our website, but
Yeah, that's also a really good resource to use, just to hear firsthand experience. Like we've talked in the past couple of days, we've talked a lot about our experiences with you. That's another place to look, just to get other people's perspective and experiences on it as well.
one thing about a veterinarian, you have to be not just love animals. I mean, everybody loves animals. You have to love math and science. You have to.
Yeah, everything is definitely very math and science based. I know we talked about being very science based, but we also have to do a lot of math as well. Just as far as like, we have to calculate what kind of dose of medicine somebody needs to get based on their weight, or how long they need it over. So math and science are definitely two very predominant things we use in veterinary medicine.
I dropped the link to our website. It is basically a branch off of the site you guys have already been using to access your One Health modules, but this is kind of the parent website for you guys to navigate to. Feel free to look through that and find our interview videos if you'd like to hear more.
You shared your pet. You see my pet behind me. We have some road runners that for the second year are nesting in a tree
Cool.
in our barnyard. So there's the male and female both share in the incubation and feeding, and so they take turns after they change about 7:30 at night. Whoever's going to stay there all night.
That's awesome. Maria has a farm too.
Yes.
Do you have road runners at your farm, Maria?
I have cows, peacocks, chickens, dogs, cats, and 2 birds.
Awesome. Aaron, we'd love to see a picture of your dog tomorrow. Please do. Yeah.
Okay, well, it's 3:05. So if anyone has anywhere that they need to go or need to be, feel free to jump off. If anyone has any questions and wants to stay a little longer, we will be here.